we pull these modules together, it really starts by creating a great team to have. There's many consultants that work with us here at Alosa, but we find a subject matter expert who is both proficient in practice as well as understanding and interpreting the evidence. And working with our core team of doctors, we sit down and talk about what are the most important changes that are going on within the profession in that area. And sometimes we have to balance the difference between what it's like to be a specialist. So if we're doing a chronic obstructive pulmonary disease module or COPD module, and we have a pulmonologist, we have to bridge that difference between what a pulmonologist thinks and a primary care doc, and we kind of bring that all together. So that team is probably the most important starting point. We sit down and have a kickoff meeting to start off every module and really outline where we think this is going to go, what the evidence is, and really have that conversation about what primary care doctors need to know to change their practice and improve and enhance their care of patients. From then, we have a group of people here, myself, Jing, and several other physicians who really dive in and develop all of the training that we do for our academic detailers in the field. And we really focus on that as our kind of first step to make sure that we're getting the messages, that we have the key data that we're going to convey to them. And it really provides an opportunity for a visual format for our docs to kind of get behind and have these awesome debates. The clinical meetings that we have to create these topics have such rich discussion, whether it's nitpicking the methods of the study to whether we agree with the findings and do we agree with the guidelines, or do we feel like they missed the boat on how they interpreted findings of a key study. We have all those debates, and sometimes we agree with the guidelines and sometimes we don't, but it's a really fascinating and enriched discussion because so many different perspectives are brought into the room, and so many brilliant minds who do research and publish extensively go into thinking about how we're going to put together this module. After we've come up with this evidence and gone through the training that we're going to do, we have a medical writer who takes that content and creates the evidence document that we really use as the backbone of our modules. And then the rest of the team goes on and develops the UNAD. And the UNAD is a lot of fun to create. We have almost more interesting dialogue about how to communicate these messages to the providers than we do about the evidence itself sometimes. We have just this fun dialogue of, I think this word is the most important and we really need to convey things in this way, and this graph makes no sense to me. How do we make it readily understood by the providers that we're meeting with? Then we have the primary care docs in the room that says, okay, you need to think about, that's the great evidence, but how am I going to implement that? And really making sure that what we're providing as recommendations are practical and implementable.